Have you heard of a cervical sweep but aren't really clear about what it is? Let me explain. A cervical sweep or membrane sweep is a procedure that's said to help kickstart labour. Usually performed by your midwife in your antenatal appointments, they will insert a gloved finger and sweep around the cervix to try and separate the amniotic sac from your uterus. This releases hormones called prostaglandins, which are said to help trigger spontaneous labour without the need for synthetic hormones. Sounds straightforward, but what are the pros and cons? I'm Rose, founder and instructor at Birth and More, where I teach antenatal and postnatal classes in Dorking, Surrey, and I support lots of new mums. So let's start with the benefits first of all. It is a drug-free way of encouraging labour along. It reduces the chance of medical intervention because it can increase the chance of spontaneous labour within 24 hours. However, there are downsides too. It doesn't always work, and the procedure itself can actually be very uncomfortable for some women, and they can experience cramping and spotting afterwards. Every pregnancy is different, and of course the choice is completely yours. So it's really important to have the information you need to make an informed choice about whether it feels right for you. The NHS recommends it's offered to women from 39 weeks pregnant. However, I regularly hear of women being offered the procedure much sooner than that. If your pregnancy does go over your due date, it may feel like the right thing for you. However, there are many women who want to wait for spontaneous labour because they want to avoid the increased chance of further intervention that comes with having a sweep. So make sure that you make an informed choice about what feels right for you. To be absolutely clear, a vaginal exam and a cervical sweep are completely different procedures, and a practitioner should never conduct a sweep during a vaginal exam without the correct consent. If you have any questions or you want to share your experience, then please pop them in the comments below. Be sure to follow along for more birth and pregnancy tips like this one, and tag a friend who might find it useful.